All right, recording should have started. All right, so medical terminology, chapter 5. So really with the medical terminology, this is the foundational anatomic and medical terms and abbreviations in written and oral communication with colleagues and other healthcare professionals. Like I mentioned before, these are the things we're going to be talking about. We're going to look for how we're going to document, and things like that. So medical terminology is used to describe and record every aspect of patient care. Camera back on too. There we go. Excuse me. Including medical history, assessment results, treatment outcomes, all the things we're looking for. This all fits in that medical terminology. And everything we learn about in medical is really derived primarily from the Greek and Latin terms. Right. So incorrect medical terminology usage could lead to ineffective or even harmful treatment of a patient. Could also cause a patient to lose trust in your ability to provide appropriate care. And we talked about, even abbreviations, right? Like CP, chest pain, or cerebral palsy, right? And how we're going to document things for that continuation, that continuity of care from what we do as an EMS provider, working into the hospital setting, into the ICU or med surge, or even going into rehab, when the documentation is then passed along and passed forward. So how we document things and what kind of abbreviations we utilize and things like that will definitely help towards that. Camera over for a minute. So your comprehension of key terms or acronyms, symbols, abbreviations is important for effective communication and documentation, right? So understanding medical terminology requires you to break down each word into separate components, prefix, suffix, root words, and also have the good working knowledge of those parts. So some EMS systems as well have specific lists of approved medical abbreviations and terms. I don't know of any that I've utilized that have specific ones you can and cannot use, but Medicare does have a list that's out there as well, that will tell you what you should and should not be using for medical terminology as far as documentation goes. So the more extensive your vocabulary is, the more competent you will seem uh, to be by the rest of the medical community, and how you're looked at, and the better the patient care you will also be able to deliver as well. So one thing you can use is you can download like medical terminology apps that are out there, or carry a field guide or documentation handbook. They're there if you're not sure of a certain term, and you can look it up. Apps are phenomenal. I use them a lot, especially in the interfacility transport world for doing critical care medicine transports. There are medications out there I've never even heard of, but I never take a medication until I learn about it. So I have different apps. I spend up to $50 an app sometimes, depending on which one it may be, to utilize in the field of work that I do. But there are some other apps that are out there, and one important one and that everybody should really have on their phone is Hippocrates, which is free. And it's a really good app to have, especially for medications, pill identifications, things like that. It also helps you be familiarized with terms as well. So the most medical terms have that Greek or Latin origin, which we just talked about. So eponyms or is the name of a disease or a device, procedure, or drug based on the person who invented, discovered, or first described it. Some examples would be like McBurney's point. Has anybody ever heard of McBurney's point before? No. That's something you're going to be familiar with. And that's the location of the appendix. Okay. Foley catheter, right? Babinski reflex. You guys ever heard of the Babinski reflex before? Feel free to unmute as well, because I can only see Sean right now because he's the last one that spoke. Because I open up my camera to see everybody else and I can't see what I'm teaching at that point. So Babinski reflex is actually very important because it's going to show neurological changes in pediatric versus adult and how either the toes curl in or fan out. And when we start talking about pediatric assessment in neonates, we're going to be checking Babinski reflex for neuro assessment. But once you get to the walking age, it changes from being either flexing in to fanning out, based upon neuroassessment at a walking age, it changes over. So an adult Babinski reflex will be different than a neonate or pediatric before they start walking. Crohn's disease, cesarean section, right? Levine sign. Everybody heard of Levine sign before? So Levine sign, you guys can see my camera, right? Okay. Levine sign is when you put the hand over the chest like this, you walk up to a patient and they're squeezing like this, right? That's Levine sign. That shows that's indication that it's probably most likely going to be a cardiac event versus a hand across the chest like this would be more intercostal muscle type deal. So if you walk up to a patient who's pale, clammy, diaphoretic, and they're clutching their chest like this, that's a positive Levine sign, right? And the other thing is APGAR score. And we'll cover more of that in obstetrics because you're going to have to memorize the APGAR score and how that works. So you can say all these different signs and points and things like that. They all come from a specific origin. Homonyms are pairs of words that are pronounced almost the same way, but are also spelled differently and have different meanings. All right, antonyms are pairs of words, word roots, prefixes or suffixes that have the opposite meaning of another word. An example would be you as in good, so EU, or mal as in bad, or ad is toward and ab is away. So if I said the patient had eupnic breathing, that would be normal breathing, right? If I said a patient had malpractice, that's bad, right? They did something wrong in the practice of medicine, right? If I said adduction, right, versus abduction, adduction is when you take your arms from the side and you bring them towards your body, versus pushing them away from your body would be called abduction or away from. Right? Synonyms are pairs of word roots, prefixes, or suffixes that have the same or almost the same meaning. So an example would be pneumologist and pulmonologist, which both mean lung, right? So pneumo and pulmon would both indicate lung. So the prefix or the components of medical terms, the prefix appears at the beginning of a word and generally describes the location or intensity of the word root that follows, right? Also used to specify time or indicate uncountable quantities. So changes. Right, hold on 1 second. I apologize. I'm also the on-call manager tonight. Stand by 1 second. I apologize. I just got to send one text message to a crew member. All right. Let's see if she gets back to me. Continue on. All right. So where were we here? So changes. There's also changes the meaning of the medical term as a whole by describing the what, how, why, or when of the root. Right. So some examples would be like sub, meaning below, and cutaneous, meaning skin. So subcutaneous, right? As an administration, subcutaneous administration. Hypo, meaning low, and volemia, right? Or emia, being blood, right? So if I said hypovolemia, it would be a person with low blood volume, or hypoglycemia would be breaking it down low blood sugar, right? The numerical prefix used to indicate the number of sides, limbs, or sensory organs affected, right? So being an example, mono being 1, right? Or octo being 8, things like that. It's looking at those different numerical prefixes.
You're muted, Kevin.
Oh, there we go. Did you guys catch the last slide? All right, let me go back. That's interesting that it muted that up. All right, so we'll go back to the components of medical term prefix. And so this appears at the beginning of the word. We talked about the uncountable quantities. So changes of this would medical term as a whole would describe the what, how, why, or when of the roots. So an example of this would be like sub being below, cutaneous means skin, so subcutaneous, which would be like a subcutaneous injection. Hypo meaning low, and if I said emia, that would be blood, right? So if I said hypovolemia, would be low blood volume, and our hypoglycemia being low blood sugar. And then numerical prefixes used to indicate this number of sides, limbs, or sensory organs affected. So mono being 1, but if I said octo, you'd be 8. Different examples of that. Other components for the suffix or components that are added to the end of the root word. So changes adds to the word's meaning provides further definition. Right, usually specific specifies a procedure, condition, disease, or part of a speech. So an example would be like ACE, which indicates an enzyme like lipase, which is an enzyme that digests fat. Right. Another thing with lipase also is that can also be a lab test as well that they run in the labs as well a lipase test. Root words would establish the basic meaning of the word and frequently indicate a body part. So several root words are used to describe color. All right. So if I said cyno, that would be what color?
Blue.
Blue. Perfect. All right. What if I said leuco? Or if I said leukocytes?
White.
White. Leukocytes being a white blood cell count. Okay. If I said erythro?
Red.
Red. Yep. Right. If I said sero, like cirrhosis of the liver causing jaundice, which would be a yellow color. Perfect. All right. If I said melano, black, right? That'd be black color. And we'll actually see that in types of feces. Sorry, in blood in the feces, right? So polio or polio is gray. ALB is white, and chloro is green. So different things you're going to see in the field as well. So combining forms and vowels. So combining vowels facilitate the formation of new, more complex terms, right? So a combining form of a root word prefix or suffix with a combining vowel. So if I said osteopathic, the root word being osteum, which is Greek for bone, the N is then dropped, and the combining a vowel O is added to create the combining osteo. Adding the O facilitates the addition of a second combining word or form called pathy. So with that being said, the root word patho meaning disease, right? So guidelines for adding and combining vowels to root words. We're going to use a combining vowel before a suffix that begins with a consonant. So cyto, right? CYTO, and then LOGY, logy. And then we can use our combining vowel to join root words gastroenteritis, which would be if you break that down, it's an inflammation, ITIS. Is anything that ends in ITIS is inflammation in the gastro or in the intestines, right? So anything in the gastro section. So gastroenteritis. Do not use a combining vowel before a suffix begins with a vowel as well. So compound words, right, are terms that are more than one root word. Each root word would then retain its basic meaning. So examples would be like electrocardiogram, thermometer, or osteoarthritis. Use some there. All right. Plural endings. So rules to change a medical term from a singular to plural. In most cases, add an S to the singular word. But for some medical terms, words ending in A or AE, example like vertebra versus vertebrae, so one versus multiple. Word endings in IS or ES, examples would be diagnosis versus diagnoses, so one diagnosis versus multiple. The word ending in X or IX changes to ICs, so example would be appendix or apices, or sorry, apex or apices, so one or the other, the apex of the lung or the apices of both. Words ending in IN or UM, and ON or UM change to A, like ganglion becomes ganglia, and words S change to I, like bronchus versus bronchi. All right, so those different ones that are there. All right, any questions on all that mess? A lot of stuff that we've already been doing, right? You guys have been EMS for a while. You've already been speaking this language as it is now. Just a good review. Now, planes. Why are these so important? We have to know which way the body works. If you start getting into radiology, this becomes way more important. Ultrasound and things like that, but those are more into the paramedic level. So the topographic anatomy. So superficial visible features on a surface of a body serves as guides or landmarks. So we have something called the anatomic position. Right? The anatomic position is a person standing, facing you, arms at the side with palms of the hands facing forward, so the thumbs point away from the body. This is a true anatomic position, as you can see in this photo here. Okay, the anatomic planes and axes of the body, right? So the anatomic planes is an imaginary flat surface dividing the body horizontally and vertically into sections, right? So the coronal plane, think of a crown, right? It starts from one side like this and goes over and around to the other side. That's called the coronal, right? The sagittal plane goes from front to back this way. And your transverse plane is like cutting somebody in half this direction here. All right. So the coronal plane divides the body vertically from ear to ear into front ventral and back dorsal positions. The transverse or the axial plane divides the body horizontally at the waist, creating a top and bottom portion, like I said, like cutting in half. And then the sagittal plane divides the body vertically from front to back. The mid sagittal plane divides the body into equal left and right halves. All right, so think about medial, as you can see here, going down this direction. All right. The axis is an imaginary line that divides the body equally and creates a point of rotation. Right. And we'll talk about the axis in human body as well for the axis. Let's see. So the anterior posterior axis is perpendicular to the coronal plane. The longitudinal axis is perpendicular to the transverse plane, and the horizontal axis is perpendicular to the sagittal plane, also called the mediolateral axis. Now, I'm going to tell you some of the important ones you need to know on this, not all of these. So a cross section is taken by slicing across an object perpendicular to its long axis. So a longitudinal axis is a view of an object cut along its long axis. All right. So the ones to know are your transverse, your sagittal, and the coronal. We're not sure where that is on here, but the coronal plane. It's one that goes from side to side like the crown. All right. Those are the three that you really need to know, have an understanding for those. And the rest of these all kind of fit in and kind of fall into place. Right. So many body areas have specific names. Right. So a major muscle in the neck would be your sternocleidomastoid muscle. Right. The muscle in the neck that is a combination of the sterno, the cleido, and the mastoid refers to as the sternum, clavicle, and mastoid process. Right. So that muscle, if you can see on here, kind of runs in the neck up in here. All right. The body cavities, the dorsal cavities, which would be the posterior, which include the cranial cavity and the spinal cavity, and the ventral cavities, which would be the anterior portion of the body, including the thoracic cavity, abdominal cavity, and pelvic cavity. All right. So you have dorsal being out back, ventral being in the front. So you can see the different cavities that are on here. All right. We have the abdominal cavity, the pelvic cavity, right? The mediastinum, which runs right down in the middle. And we'll talk more about that when we start getting into more trauma with a pneumomediastinum. We start having air trap in that area as well. We'll get into that later on, though. All right. But think of dorsal being on top. As you can see, the dorsal body cavities up here. Those two. And then you have your ventral cavities, which are all located here. All right. Directional terms, very important. These are all very important terms you need to memorize if you haven't already. This describes the relative positions of the body parts as well as imaginary anatomic divisions. So this occurs in pairs, superior and inferior. Remember, superior being high, inferior being down low. Okay. So the superior portion is the portion above the closest to the head from a specific reference point. So if I said that the chest would be superior or inferior to the abdomen, what would you guys think? Is it superior or inferior?
Superior.
Yeah, superior. Turn up your volume a little bit so I can hear you. All right. So if I said the foot is inferior or superior to the knee,
Inferior.
Inferior.
yep, inferior. Perfect. All right. So then we have lateral and medial. Okay. So lateral being out, medial being midline, right? And then we have proximal and distal, as you can see with the arm located here. So would the elbow be proximal or distal to the wrist?
Proximal.
Right. Exactly. Proximal. So why is this important? Well, we have to now remember we're getting into advanced level stuff now. So advanced anatomy and physiology. Remember that there are 3 bones in each finger, 2 bones in the thumb, right? So we have our looking at our fingers here. Up here would be your distal phalanx, medial phalanx, proximal phalanx. Okay. And your thumb, that would be your distal and proximal phalanx for the phalange. Okay. So that's what you guys are going to have to understand, memorize is we start looking at these different distal and proximal. They actually fall into different body parts as well when we're looking at fractures. Right. Then we also have metacarpals. We have our carpals and our 8 bones in the wrist going into the ulnar and radius, working its way up to the elbow, humerus, up into the shoulder. All right. So now we have superficial and deep. So superficial, remember being closer or not on the surface of the skin, deep being farther inside. So we're going to remember those during our burn injuries. Superficial, working our way down. Excuse me. We also have anterior and posterior. Anterior refers to the belly side of the body, also called the ventral, and posterior, also called dorsal. All right. Then we have our palmar and our plantar. We're going to see a lot of that. Plantar flexion being down at the foot, and then palmar being up in the palm. So why is this important to us? Palmar and plantar. What assessment are we utilizing for that?
CSMs.
Not just CSMs, but think about neuro assessments, right? So we're doing a Cincinnati stroke scale. What do we ask them to do?
Grip, push down.
Right. So if we're having a patient put their arms up like this, we have to turn their hands up, right? So we're gonna look at that supination versus pronation, palmar flexion, things like that. The plantar is on your foot, so pushing down like you're stepping onto a plant. Plantar flexion, those would be for CSMs, right? We're gonna push down, pull back towards you. This is why it's so important. We're doing a neuro assessment, and we're looking at our palmar and plantar flexions, and also drawing a blank now. Extension and flexion, so out and back in again. That's all going to be part of more in detail the neuro assessment, which we'll cover in neurology when we talk about neurology itself in the neuro section of the program. And the apex is at the tip of the structure. So if we're listening to heart sounds, if we're listening to the apex, we go to the tip. We'll talk about that later in cardiology. So table 5.9 shows common directional terms. So right and left, top and bottom, middle, side, closest, farthest, and works its way out. Yes. All right. I don't know why I didn't unmute. So we look at these different terms here, movement and positional terms. So extension will be coming out versus flexion coming back in. If we're adding to the body. If you can see my arm here, it goes through the body itself. Or abduction, moving away from the body, as you can see here. So drawing arrows as well. This would be abduction. This would be adduction. Then flexion coming in and extension coming out. It doesn't have to necessarily be the arm. Can we have a hyperflexion of the neck? Yes, everybody should be shaking their head. Yeah, we can. Hyperflexion, hyperextension of the neck, depending on like diving injuries. So we'll talk more about that later in trauma and of the neck and spine. But yes. Right. This picture here shows the neck in a patient found in a supine position. Supine being laying flat. A would be neutral. So this is your neutral up here, neutral inline position. All right. B shows the extended coming up as well. Or sorry, flex, and this is extended down here. So neutral, flex, and extended. So hyper indicates excessive movement. So hyperflexion or hyperextension, right? So that can happen to like the knee, it can happen to the elbow, it can happen to the neck, any different part of that. So hyperflexion or flexion of a body part is beyond its normal range of motion, right? We hyperflex it. Hyperextension refers to extension of a body part beyond its normal range of motion going out. And this can definitely tear ligaments and tendons, right? Supination is when your palms are turned upward like this. Think about holding a bowl of soup. Okay, so right, is turning the palms downward. So in Cincinnati stroke scale, we do something called a pronator drift. So arms out like this. We can have them do this as well, but usually arms out straight, pronation, pronator drift, which arm drops down. Extremity toward the midline. So internal rotation towards midline, external rotation coming back out. Sorry about that. Apparently my internet's slow right now. All right. External rotation being turning outward. Right. You guys still hear me okay? Did I lose you at all? All right, let's try this then. You guys hear me okay now?
Yep.
Right. I don't see any cameras right now, but I don't know what has happened. All right, but you guys said you can hear me and you can see the screen fine?
Yep.
Yes.
All right. I just switched over to my phone. I'm running the data off my phone now. I think the internet just dropped again. All right. So, all right. So bilateral appears on both sides of the midline. All right. This will be important. We start looking at abdominal things as well. Examples would be eyes, ears, hands, feet. Unilateral structures appear only on one side of the body, like the spleen, left side of the body, or liver on the right. So ipsilateral or the same size, same side of the body, and contralateral is the opposite side of the body. So let's go into the 4 quadrants. So the abdominal cavity is divided into 4 equal quadrants: right and left upper, right and left lower. Remember that the right and left refer to the patient's right and left, not yours. Right? So the way to remember this here is the center line for the abdomen would be your umbilical here, and we look at the upper and lower quadrants. So the liver would be in the upper right. So when you're palpating the liver, and you guys can try this on yourselves if you want to, it is a little painful, and you guys will learn this more in your assessments. But when you palpate, you have the patient take a deep breath in, and on exhalation, you curl your fingers underneath the rib cage on exhalation, and you should be able to feel about 2 centimeters of the lower portion of the liver. Okay, so why is that important to feel for the liver? What are your thoughts? Anybody can jump in. Why would you want to palpate the liver? To see if it's what?
It's tender or enlarged.
Yeah, enlarged, right? Absolutely. Here's a little side tip. One of the first indicators of congestive heart failure in a pediatric is an inflamed liver. All right. We'll talk more of that in peds. All right. So we have our different quadrants, right? Learning where our gallbladder is located, the liver is located, right? Understanding those. And we'll talk more about the different signs that are out there for like gallbladder, pancreatitis, being Cullen's sign, Gray Turner sign for kidney injuries and splenic injuries, things like that. Iliac crest, right? So you see the colon down here, small intestines, and then again, this is just terms now. When we get into abdominal, we'll definitely go more in depth on this here, right? But then you can break it down almost like a tic-tac-toe board. And we have the left hypochondriac region, epigastric region being here, right hypochondriac region, right lumbar, left lumbar, peri-umbilical region down here, right? And we look at our right iliac region. We have our hypogastric region, right? Hypo being low, epigastric, hypogastric being lower down to the colon, and our left iliac region as well. Think about that because the iliac crest runs straight across here. Iliac crest is here. So that by looking at this, we have our different regions for the iliac. All right. So this is different ways to remember it as you're doing your assessment. Remember that when you're doing this, though, it's the patient's right and patient's left. So you're looking at them, it's opposite of what you're looking at when you're doing your assessment. Same thing if you're looking at like CTs and X-rays, it's going to be opposite of what you're looking at. So the left lung will be on the right lung will be on the left, looking at the photo itself, just reversed. All right. So prefixes indicating position, direction, and location. Specialized prefixes specify position, direction, location, and described during movement of the body or something within it. This indicates the location of an organ, foreign body, or mass. Okay, refers to the direction of radiation or ultrasound waves as well. So specific terms that you should already be familiar with would be, right, prone. So our prone position being here. This is supine, right? This one here will be like a seated position here. This is going to be our lateral recumbent, depending on which side they're going to be on. So this is going to be left lateral. All right. Semi-Fowler is sitting back with the knees at a 45-degree angle. So sitting, or this is more like your semi-Fowler position here that you're seeing in A. So abbreviations, acronyms, symbols. So these enable faster communication. So do not trade speed for accuracy in patient care, right? I expect you to be very thorough as an ALS provider, doing a very thorough assessment, even if it's rapid, having understanding what you're touching, what you're looking for, and being more detailed than you are as an EMT. We'll cover more of that later. Use only commonly understood acronyms and other abbreviations. So all acronyms and abbreviations, but not all abbreviations are acronyms. So the abbreviation is pronounced with each letter separately. EMT, emergency medical technician. An acronym forms a word like USAR, which would be urban search and rescue. Medical abbreviations can be extremely useful for documentation, but be consistent with those approved for use in your EMS system. Like I had mentioned before, CP chest pain, CP cerebral palsy, SOB, we can think of some other ones you can think of for that one there, but souls on board, shortness of breath, right? So there's different things that they actually get a different meaning. So for me personally, I like writing it all out, where there's no confusion whatsoever. All right, so the error-prone abbreviations. So the Joint Commission and Institute for Safe Medication Practices, the ISMP, have each published a do not use list of abbreviations to prevent serious errors. Example, HS on a prescription can mean hours of sleep or half strength. That'd be bad, right? Half strength versus hours of sleep. Avoid using trailing zeros after a decimal point, but include leading zeros as well. And this is something that is very important to understand. So what they mean by that, right, is if you have a medication that's 5 milligrams, it would just be 5 milligrams. If it was 0.5 milligrams, it'd be 0.5 mg, not this 0.500. That can be very confusing. So we're going to cross that one out, right? So how you write things down. If you have a patient who is, let's say you're giving epinephrine to a pediatric, our dose is going to be 0.15 milligrams. Okay. Now, if you just wrote down 1 or 0.15 milligrams and you didn't see that decimal point that was there, they'll look like 15 milligrams. That's why it's very important to put that zero in front of it. Excuse me. If I brought this one down, if I did 5.0 milligrams, if someone didn't see that decimal, they might get a very high dosage of something at 50 milligrams. Does that make sense?
Mm-hmm.
So when you are writing stuff down in your narratives, when you are documenting, when you are doing anything with this, you need to make sure you document it this way. This is very, very important. Also have the idea of how you word things, mLs, right? Milliliters, milligrams, mcg is micrograms, right? G is grams. So understand all the different abbreviations as well with that. When we get into pharmacology, we will cover a lot of this in depth. When in doubt, though, write the full term out if you're not sure which one it is. All right. The list cannot include certain abbreviations prohibited by the commission, such as another one that also means micrograms is what they call, it's like so it looks like this. That's horrible. Like that. That's the same thing. Hard to write on the screen, but these are things you can look for. All right. Here's a list of commonly used symbols as well. Now, when you're documenting, you don't really have the male and female symbol, so I write out male and female. If I'm doing negative in my run reports, if I'm writing something out, I don't just put a line, I do a line with a circle around it. That's negative. That's positive. All right. Increase, decrease, alpha, beta. All right. Perfect. So medical terminology related to pharmacology, be familiar with the terminology related to medications and medication administration, such as the common prefix, the common metric conversion, and the common medical abbreviations that are there. All right. Here on this table here, micro, MICRO, right? MC. So if it's micro, then grams would be MCG. Milliliters or M would be milli, and liters be ML. Kilo and grams. So kilograms would be very important for us, right? In weight-based medication administration. So it'd be kg. Right. And then how to convert stuff over. And we'll talk about that in pharmacology, how to convert pounds to kilograms and use it the easy way. I'll teach you the street way and then how to do it on a calculator. All right. So any questions on medical terminology? Like I said, tonight's going to be a short night. All right. Why don't we take 10 minutes, come back at 6:55.
Okay.
All right. And then we'll finish up. I'm going to switch everything over.